I'm John Robertson, Communication Specialist at Pottstown Area Health and Wellness Foundation, and I just want to start us off by thanking our panelists and moderator for taking the time to be with us tonight and having this conversation um, with all of you who are joining us live. We are recording tonight's conversation, and it'll be available as a resource for folks who were unable to join us tonight. So for folks watching later, we appreciate you as well. Just to share a little bit about our organization, TriCounty Health Council is a collaborative effort by leaders from Pottstown Hospital Tower Health, Community Health and Dental Care, Creative Health Services, TriCounty Community Network, Pottstown Area Health and Wellness Foundation, and other community organizations in order to improve health outcomes in Pottstown and then surrounding communities. Special thanks to Montgomery County Immunization Coalition, Pottstown School District, and YWCA Tri-County Area for their contributions to this town hall as well. Just to share a few housekeeping items before we get started. You have some options with the view in Zoom. Participants are currently in presenter mode. You can click gallery view at the top right corner of your Zoom screen, and you can change your personal view mode that way. Closed captioning through Zoom is located in the black bar at the bottom of your screen under more. For folks watching this later on YouTube, the captions are available under the gear icon at the bottom of your video player. Our audience tonight can use the Q&A function to ask questions not addressed by the panel or any follow-ups that you may have. The Q&A, as you ask questions, will only be viewable to our event support staff, so those won't be publicly available, and we'll share those in the Q&A time period that we have laid out. Use the chat feature for any assistance with event technology. If you have any trouble with the connection through Zoom, we have a second live stream available on TCN's Facebook page at facebook.com/TriCounty Community Network. And following our presentation tonight, keep on the lookout for a follow-up message, which will include links to a recording of this conversation along with other resources. And those will also be available at www.tricountyhealthcouncil.org. And with that, I am pleased to introduce our friend and colleague, Myra Forrest, Dr. Myra Forrest, who will moderate our conversation tonight. Myra serves as the education advocate at the Pottstown Area Health and Wellness Foundation, and she's been a voice for advancing education in the region for decades. She's taught students at every level from nursery school to doctoral programs, and was a teacher and administrator in Pottstown School District from 1992 to 2005. In addition to many other roles in Pottstown and surrounding areas. She is currently the board chair of Pottstown Hospital Tower Health. And with that, Myra, I will hand it over to you.
Oh, thank you, John. That was a wonderful introduction. I just want to review the agenda for those who are participating this evening so you have an idea of what's going to be happening. I'm going to be introducing our panelists and just saying what their jobs are, and then they're going to tell you a little bit about themselves so you know who they are. And then we're going to have approximately a half an hour of discussion and questions with the panelists. After that, there will be any questions that the community members have can be answered by our panelists. And I would like you to know that some people have already submitted questions prior to this evening. Those questions will probably be answered first before we get to the ones that are given tonight. And then John will close with some final remarks. So I would like to move now to our panelists. I would like to first introduce Patience Turkowski. Patience is an oncology nurse practitioner at Pottstown Hospital Tower Health. So Patience, could you tell us a little bit about yourself?
Sure. Thank you, Myra. My name is Patience Turkowski. Like Myra said, I am the oncology nurse practitioner at the Pottstown Hospital Cancer Center. I started in healthcare when I was 18 as a U.S. Navy corpsman, and I've worked my way up to become a nurse that worked in the emergency room and the ICU, became a nurse practitioner. I did internal medicine before I specialized in oncology, and I'm very thankful to be here. Thank you.
Thank you, Patience. I'm going to turn to Brian Parks now, and I'd like Brian to tell us a little bit about himself.
Thank you, Myra. I'm Brian Parks. I'm the Executive Director of the TriCounty Active Adult Center. I've been working in nonprofits for the past 20 years, and most recently with the Active Adult Center, we keep older adults active, healthy, and engaged and living independently for as long as possible. And in that role, we help almost 2,000 older adults every year stay active and eat well and live independently. So thank you very much.
Thank you. Thank you for both of you for what you do. And we thank you for being here tonight and helping us with this important information that we're going to be talking about this evening. So I'm going to move to the first set of questions. The first set of questions is more general. It's about primary care for people and patients. I'm going to ask you this first question. What is considered routine preventative care, and why is it important?
So Myra, routine preventative care would include your annual physical, making sure you keep going to your primary care physician, ensuring that you're getting your blood pressure checked, cholesterol checked. This is where we're going to find out if you have diseases that come as we get older or that are hereditary. When you go to your primary care doctor, they're going to find out if, with doing tests, is your blood pressure high? Do you need to be put on medication? Are you diabetic? Are you going to need to be put on medication? Do you have any heart issues? They'll do EKGs, things like that. So that's why you need your routine preventative annual physical, to make sure that they discover these diseases where they're controllable. The other reason is to make sure that they're discussing preventative measures with you and making sure that your vaccines are up to date to help prevent other disease processes.
So it sounds like this is something really important to do, because if you don't keep up with this, some things can happen that should not.
Absolutely.
Okay.
One of the biggest things that patients say to me is, I've never had anything wrong till I've come to the doctor. They had things wrong, they just didn't know about them because nobody was able to tell them, because it wasn't found until they did go to the doctor.
Right. So I'm going to ask you a question that people that don't go to the doctor perhaps that much might want to know. What can somebody expect that goes for an annual physical or a preventative care visit?
When you go for an annual physical, you're going to go, they're going to check you in, they're going to check your blood pressure. They're going to go ahead and, depending on your age, they might do an EKG. The doctor's going to do a physical exam, and they're going to listen to your heart to make sure it's a regular rhythm. They're going to listen to your lungs to make sure they're clear and they don't hear any kind of abnormal lung sounds. They're going to feel your thyroid and make sure that your thyroid's not enlarged. They're going to go ahead and feel your abdomen, make sure you don't have any pain. They're also going to ask you a lot of questions that might make you think of things that you thought were nothing, but might be something for them that they want to investigate further.
Okay.
Check your weight and temperature as well.
All right. Thank you so much. This next question I'm going to throw out to both of you, but I'd like Brian to answer from the standpoint of the people that he deals with most of the time. What can be done in our daily lives to ensure our health and well-being? You deal with a different age category, Brian, so maybe you could answer that from that particular perspective, and then we'll go to patients to answer as well.
Sure. So what we tell people is it's use it or lose it. And that is both physical and mental. So you really want to stay active physically as much as possible to your ability. Walking is one of the best things you can do at any age. And, getting out, exercising, biking, we've got some great trails locally. You don't have to join an expensive gym or get a trainer or subscribe to some service just to stay active and get the benefits of physical activity. And they're both physical and mental benefits. Physical activity helps with stress, it helps with mood, and can really improve your mental state. Second of all, eat well. It seems basic. It seems like something you hear a million times, but that's how important that it is. Make sure that you're eating whole foods, a lot of fresh fruits, vegetables. Avoid as much as possible a lot of convenience or processed foods. All these things will improve your overall health. And finally, stay social. Don't isolate yourself. That's really important for both mental health and cognition, to stay active mentally and engaged in things, especially as you age. And it becomes more difficult as you age to not self-isolate. So those are really the basics.
Okay, before we move on to patients, I just would like to say that I was fortunate enough to visit your center and have one of your delicious meals. You have really, really wonderful cooks, and the food is delicious at the center. And it's very, very cost effective as well for older adults.
Yeah, absolutely. We do a free lunch. Currently, it's 3 days a week as a drive-through. In more typical times, it's 5 days a week. And it's a social event and a nutritional benefit for them.
Yes, it's a wonderful service that you offer. So
Thank you.
patients, what can you add to this?
Well, he did a wonderful job. That's everything you should be doing. But the other thing that I would also recommend is making sure you're getting good night's sleep. Sleep is more important than people realize, because if you don't have a good night's sleep, you're not going to have the energy to have activity and so forth. But activity, eating, and sleeping and staying social are all the important things that people can do.
Okay, thank you. We're going to move on to a different topic now, and that topic is a concern to all of us these days, and that happens to be COVID-19. So I'd like to ask both of you, probably patients can answer this a little more. What are doctors' offices and community organizations doing to keep patients safe during COVID-19? And Brian already alluded to one thing, but both of you can answer this, but let's go to patients first for the answer to this.
My office is in the outpatient center attached to the Pottstown Hospital. When you come in to the outpatient center, there is a temperature scan. Obviously, there's signs saying, please wear your mask, because in any healthcare facility, masks are still required for visitors, patients, and staff. So you would come in with your mask. There is, you don't even know it, but there's a big thing that just scans your temperature as you walk in, so they can see if you're febrile or not. Then they have a set of questions they ask you. And I'm sure that by now, if you've gone to the airport or any federal building or any physician's office, have you been exposed to COVID? Do you have any symptoms of COVID? They ask that whole thing of questions for you to screen and make sure you're not at risk for bringing it into the doctor's office. They are washing all equipment down after each and every patient use with sanitizing wipes that are proven to do the 99.9% virus, including COVID. They're minimizing the amount of people who are allowed in. There was a time, and it was very frustrating for us, our patients, and family members, where they were really minimizing, not letting patients have any family members, even in doctor's offices, right? They would have you call from the car and say you could come in, so they could make sure there was nobody in the waiting room and you would be by yourself to minimize exposure. But now they're letting more people come into the waiting rooms, keeping them 6 foot apart, so everything is socially distanced. They are allowing a family member per patient to come in with them, especially in my facility, because we're talking about cancer and cancer treatments. And then, we are socially distancing them in the office, or making sure that their time that they go into an exam room, and try to minimize how much time is they're around other people. We also have barriers up for our staff to prevent that. And they have hand sanitizing stations and sinks throughout to make sure that everybody can do hand hygiene, which is very important.
So it seems like you've done a lot of things at the hospital.
And we're still doing, yes.
Right, right. So Brian, let's talk about the TriCounty Active Adult Center and how you have adjusted to dealing with COVID-19 for your participants.
Sure. So serving also a somewhat more vulnerable population, we've upgraded some of our protocols. So lunches are served in a drive-through. We don't have anybody eating in the building now. Masks are required for everybody. We've upgraded our ventilation filtering systems to help filter the air more effectively. And we have limited the number of people in each class and in the building at any one time to allow for social distancing.
Okay. Thank you. So something that just has happened, I think within the last 24 hours, is that the CDC has just approved the Pfizer vaccine for children ages 5 to 11. So as participants tonight, what do you feel, what's your opinion about this, your recommendation in regard to children and the COVID vaccine?
Well, there has been a spike in the children's cases, especially since Delta has come around. And so they have done testing, and the CDC is recommending that children from 5 to 11 do get the vaccine. It is a lower dose. And the reason for that is they've seen an uptick when people started to become more involved with each other. And even though the kids are wearing masks in school, there is an uptick in COVID cases in children, even with wearing the masks. So they trying to minimize that. When some of these kids, when they get sick, they get very sick and they're resulting in hospitalizations, and they also can have that long-term COVID, the long hauler COVID that they talk about, where they have those respiratory symptoms for 6 months. So they want to minimize that for children, obviously, because again, COVID, we're still learning so much about it as time goes on, and we're not sure what the long-term effects are. So they want to minimize them, and they want to minimize who can get it and how severe you can get it. All the hospitalizations are for, not all of them, a large majority of hospitalizations in children and adults are unvaccinated. So the vaccine has been given to a lot of people. It's proven effective, and less people are ending up hospitalized that are vaccinated. There are a few, but they're not getting as severely sick as the unvaccinated ones. So the CDC is recommending children get this because they think it's in their best interest.
Okay, thank you so much. We're going to move on to a different topic now. And again, patients, this is actually your bailiwick. We're going to be talking about cancer prevention. That's such an important thing for all of us. So my first question for you in regard to this is, why is it important to get routine cancer screenings?
Well, the purpose of routine cancer screenings is to ensure that if you do have a disease process going on, cancer process going on, that we catch it early enough so we are more successful in treating it. So they're very important to ensure that we can fight this disease and give the patient the best chance of having a curative intent.
Okay. What cancer screenings really are recommended for adults?
So there's quite a few, but not as many as we have different types of cancer. So obviously there's mammograms for breast cancer. They're recommended for yearly. They begin them at 45. However, women, when you're, and I shouldn't say just women, but for women, when you go to your GYN, and they know your history. If you have a family history of breast cancer, when and who in your family got that breast cancer, they may recommend that you get mammograms earlier. For men, 10% of breast cancers are in men, so men should be doing self-breast exams and making sure they don't feel any lumps, and if they do, they should go ahead and see their family physician. We also do colon cancer screenings. Usually they've changed that age to about 45 because it was 50. But what they're saying is there's a DNA Cologuard. I know a lot of people have heard about that, and I have people who want to get that because they don't want to do a colonoscopy. Colonoscopy is actually the best screening tool because they can visualize. But if you're not going to get a colonoscopy, please get the Cologuard. That's 92% effective to see DNA for cancer. It's less effective. It's only about 42% effective in getting the precancerous polyps, letting them know there's DNA for those precancerous polyps, where we might be able to, if you become positive with any of those, you get a colonoscopy, and then hopefully they can get those polyps out before they turn cancerous. So if you don't want a colonoscopy, please get the Cologuard.
Patients, can you explain what the Cologuard is to people in our audience?
Sure. The Cologuard, it's on TV. It's just where you send a stool specimen, and the stool specimen is evaluated for DNA that might indicate you have cancer. So it's actually very effective. 92% is not bad for a stool test, in diagnosing that you already have cancer. My concern is the 42% efficacy and letting you know you have a polyp, because a polyp is precancerous. And if you had a colonoscopy, they would just take that out and wouldn't allow it to become cancer. But again, it's better to find out. Hopefully you find out early. Then we have a screening for lung cancer. And there are recommendations for that. If you were a smoker, former heavy smokers between 55 to 80. If you quit smoking within the last 15 years or have greater than or equal to a 30-year pack history. Now, when they talk about the 30-pack year, they're talking about if you smoked 2 packs a day for 15 years, that equals 30 pack. So I don't want people to misconstrue that the pack year is how many years you've been smoking. It's how many packs you've smoked for how long, and then you times that. And that is finding lung cancers early. Cervical cancer for women, the routine screening is getting a pap smear yearly, and that starts at the age of 25. And what that does, HPV is one of the biggest, the major cause for cervical cancer. So a pap smear will determine if you have HPV, and they're able to go ahead and treat it through various techniques and procedures before it turns into a cancer. And then prostate cancer, actually there's some discussion. There's no organization that recommends routine screening for prostate cancer. However, there is what they call a prostate specific antigen test. And also when men go to the family doctor, they'll do a DRE, digital rectal exam, and men probably know what that is. And that would tell if there's an enlarged prostate. However, when you're about 45, you should talk to your doctor about it and see if a PSA is right for you. Because if you have a family history of prostate cancer, or if your sisters have some kind of reproductive cancer, that could indicate you're at increased risk for prostate cancer. So you might be a candidate to have that PSA. But that is definitely something you should discuss. And then skin cancer, obviously you should get a yearly exam with the dermatologist to make sure that any moles that are abnormal looking are evaluated. You, as your own healthcare advocate, if you notice any moles that are changing, irregular shape, starting to become scaly or something, have that looked at because it could be a sign of skin cancer. One of the things I do want to say is that people unfortunately have put off their screenings. And we are unfortunately seeing patients further along in their cancer diagnosis. So please don't put off your screenings. They are very important. They go ahead and they find cancers when they're earlier on. And what happens is if you have a cancer that we find in one area, we go for what's called a curative intent. We want to get rid of that cancer and have you be cancer-free. But if that cancer has spread to other parts of your body, we're going for palliative care. And what that means is we're trying to give you a quality of life while you're living with cancer, because we're never going to get rid of it. So it's really important to make sure you're going for these screenings, because that will be the difference of one day you are living cancer-free or you're living with cancer and trying to manage it the best that can be managed. So screenings are very, very important.
So I have a question for you. You mentioned two specific cancers. You mentioned breast and you mentioned colon cancer, that if you had family members that had it, that you should definitely get screenings or maybe get them earlier.
Yes.
Are there other cancers that are the same, or are they basically those two?
It's basically those two right now. But one of the things I can tell you is I got into oncology because my mom had cancer and she passed away 14 years ago. The research and the information that we found out in this 14 years since I first started getting interested in oncology is so much more than I could have ever imagined. We are finding out so many things, and every day is something new, whether it's a medication, a mutation, finding out if this is something we need to check other family members for. So right now, breast and colon, because of mutations they've found, and actually any reproductive cancer. If you have a grandmother who had ovarian and a mother who had endometrial, and you're a man, let's say, that's a reproductive cancer. So you want to be more careful about, could you be at risk for prostate cancer?
Okay, thank you for that answer. So how do you schedule a cancer screening?
So it starts with your primary care doctor, going back to your routine annual physical. They're going to keep up on when your vaccines are due. When are your cancer screenings due, right? When is your colonoscopy due? Mammograms, some of the primary cares will do GYN and mammogram type things, or if you have a GYN, they'll handle that for you. But keeping up on your routine physical exams, they're going to go ahead and remind you, it's time for us to try this. It's time to do this screening, that screening. And of course, if you notice anything different in your health, then it's important for you to go to the doctor and tell them about it, because it could be a sign of something going on that they might want to do a screening or some other imaging to make sure that it's not something to be worried about.
Okay, thank you so much. Brian, I'm going to ask you a question now about community resources. What community resources aid in overall wellness and chronic disease management?
So we're fortunate in our area to have a lot of resources available, even if you are uninsured or underinsured. Chronic disease management, TriCounty Active Adult Center, the hospital, other nonprofits offer a number of chronic disease management classes and other health and wellness programs, as well as ongoing health checks. So, you can stop by, again, in regular times, you can stop into the Active Adult Center on a fairly regular basis and get your blood pressure checked or do a blood sugar check with pharmacy students that come in, or with a registered nurse that stops by once in a while. So there are a lot of opportunities out there to stay educated and get some of these health checks done at low cost or for free. And and learn about what could affect you.
Okay, so you did give some answers about this. I just want to ask you, because there's a lot of people out there that have some barriers for things like this. One of them is transportation. Cost is another one. Hours of operation, that they can't make it because of their jobs, for instance. They can all impact an individual's ability to access preventative care. So are there any services that exist to remove these barriers?
Again, we're fortunate that we live in a pretty good area for things like that. We have Transnet is a local Montgomery County transportation service. Chester and Berks have their own versions of that, and they are county subsidized, low-cost transportation. We also have the bus system in Pottstown, which is excellent. In terms of cost, we have organizations like Community Health and Dental Care, which is located at the Coventry Mall. And they do a great job of providing all kinds of health care to people who are uninsured or underinsured. We have the Maternal and Child Health Consortium in Chester County that serves some of Montgomery too, I believe. We have family services that can also help locate services for families and provide some services of their own. So there are a lot of resources out there, and many of the nonprofit organizations in our area, if they don't provide the exact service that you need, they know who can provide that service. So give them a call and they can often help walk you through the process.
All right. I think that TriCounty Network is probably a great resource to find information, because they deal with most of the nonprofits in the town. So TriCounty Network is a good place for people to start. Could you just embellish one little thing that you talked about, and that was Transnet? Could you explain what Transnet is to the people that are listening?
Sure. So Transnet is, again, it's a county subsidized bus service, and you can sign up with them. I believe if you are disabled or over the age of 60, I think are the criteria, but they'll provide low cost rides to anywhere you want to go, whether it's shopping or a doctor's appointment, to the pharmacy, anything along those lines.
Okay. All right. Thank you. I think that'll help people. So we have just a couple of questions from the community that I would like to ask either of you. Are there any differences in outcomes between virtual and face-to-face patient-provider visits?
I don't know if there's been any poor outcomes due to that. The virtual visits have been very helpful for patients who need routine care, that they can go ahead and maybe have their labs done, see a physician over the internet, trying to minimize. And it's keeping people talking to their primary care doctors a little bit more often than not. So it's helpful in that way, but there's always pros and cons. People get to talk to their doctor, tell them what's wrong. If they have bronchitis, things like that, maybe they give them an antibiotic, or if they say I have this symptom, they can order a test for them to get the test without actually having to go into the office. The con to that, though, is we don't have the ability to listen to somebody's lungs. We don't have the ability to feel somebody's thyroid. So I think depending on what it's used for, it's very beneficial because it does keep people connected. If you wanted to have just your annual physical and needed like your mammogram and stuff ordered, that might be okay as long as you have no new problems, but we shouldn't do that all the time. I know when we were doing COVID, if we had somebody who didn't need treatment, we tried to make sure that at least every other visit was in person so we could do the physical exam.
Okay. So this next question from the community is something, it relates to what I just asked you. This question is telemedicine really the answer?
I think telemedicine can be beneficial. for certain things. So absolutely, I think it has helped keep a lot of people in the system that might have not reached out to their primary care doctor because they didn't want to go to the office. And then if they had said something that was concerning, it makes it easier for the patient to understand why it was important for them to go ahead and come into the office. So I think there's definitely a role for telehealth.
Okay. So what type of health conditions have been on the rise throughout the pandemic?
We're seeing people sicker. We're seeing people who have urinary tract infections turn into sepsis, pneumonias getting out of control. Obviously, COVID has been going up and down, so we're seeing, people hospitalized for that. Blood pressure control. I have patients coming into my clinic and their blood pressures are out of control because they're afraid they have to come see me, right? But they're putting off going to see their family physician. So I'm dealing more with, getting in contact with the primary care doctor, trying to manage their blood pressures and things like that. Diabetes getting out of control, and people not having the ability to talk to their family doctor about the things they should be doing to prevent this kind of stuff, right? Sometimes when we go to the doctor, it makes us accountable to make sure that we're watching our weight, that we're having our blood pressure monitored, and we're taking our medicine. So some people, if they don't see their primary care doctor, aren't getting their prescriptions renewed, which is a big problem. The primary care doctor, when you go for your routine visits, they're reminding you how important it is to eat, drink fluids, things like that. And those kinds of things are causing the out of control blood pressure, out of control diabetes. The bronchitis is turning into pneumonia, the urinary tract infections causing sepsis, requiring hospitalizations. So those are some of the things that I've noticed as people are trying to avoid coming into the doctor's offices.
Okay. There's another question here. Why is it important to receive the flu vaccine? And are less people getting the flu vaccine this year?
I think it's important to get the flu vaccine because vaccines do work. Now, I've had people tell me a lot, oh, every time I get the flu vaccine, I start to feel sick and flu-like. The purpose of a vaccine, COVID vaccine, flu vaccine, the vaccines we've all gotten all of our lives, is to let your body recognize that it's a foreign thing in your body and let your immune system take care of it. So when you get sick with any type of virus, what's our bodies do? They cause us to get feverish, chills, because it's trying, it sends off this inflammatory response trying to take care of this and fight it on its own. That's what the vaccines are doing. They're going ahead and they're trying to get your body to recognize this. This way, when you get the virus, right, it's not necessarily going to prevent it, but it's going to minimize the amount of sickness you have from the viruses if you get them. So if you get the flu, it shouldn't be as severe if you're vaccinated because your body's already gone ahead and developed antibodies to try to take care of it. So you should still get the flu vaccine. My patients are all getting their flu vaccines. I got my flu vaccine. It's still important to get your flu vaccines and your other vaccines that are recommended.
So Brian, I'm going to ask you this question because you have addressed some of this in what you said about the Active Adult Center. What preventative measures can I take for my mental health? So
Exercise, believe it or not, is certainly up there. Get out, be active, be social. Don't isolate in your home. Sit around watching TV all day does really nothing for your mental health. Some people need to take additional steps like avoiding the news or other things that might cause them some undue stress these days, although I can't imagine why. But, really take some time for yourself. Make sure that you're talking to other people. Make sure that you have a reason to take care of yourself. A lot of people, again, who don't socialize, who don't get out, they stop feeling like they have a reason to take care of themselves, and it tends to cycle downwards from there. So, really, all the basics. But getting out, being around family and friends, and staying active that way is certainly one of the biggest steps you can take.
I don't know if you have anything to add to that or not, Patience. He covered a lot.
He covered it very well.
Here's a question about insurances. If I don't have insurance, or my insurance isn't great, how can I approach preventative care, and where can I go for health care?
So again, we're fortunate to have a lot of great organizations in our area, like Community Health and Dental Care, like Creative Health Services if you're dealing with mental health issues. And also, don't be afraid to call your doctor and say, hey, I don't have insurance. What's the cost going to be? A lot of doctors do have discounts for cash patients, and can work with you in that way.
There's also like in Phoenixville, they have the clinic. In Chester County, there's CVIM. So there's a lot of resources that will do no pay or pay based on your income, the income sliding scale. So there are resources out there. So that will help you make sure you keep up on your preventative care.
Yeah, I think there's a lot of people that don't understand how much help there is out there for them to take care of themselves. They just realize that, the medicine is expensive and going to see the doctor is expensive, but there are many, many resources out there to assist people that don't have the money to take care of themselves. So here's a question from someone who says that they haven't been doing preventative care. They haven't really been taking care of themselves at all. And they're asking, how should they start? What should they do? What should the first thing be?
The first thing should be try to find yourself a family physician. So if you have insurance, you can call your insurance company and see who they cover, or you can call Community Health and Dental. Some of the urgent cares actually have physicians that will see you as a primary care physician. So the best thing to do is check with your insurance company. And if you don't have insurance company, call Community Health and Dental and see if they can get you in there. Or again, like I said, you could do CVIM or the clinic. But the first thing you should do is find a PCP. So this way they can determine where you're at, what you need to have screened, and all of those things.
Can you say what PCP is so that
I'm sorry, a primary care physician.
You have to remember your audience.
I'm sorry.
That's okay. And I have a question I think that you already answered. It's about someone who's questioning how do they take better care of their oral hygiene, and what suggestions do we have for access to dental? And I think you basically sort of answered that one, but could you repeat that again?
You can go to Community Health and Dental. They have that, but also sometimes the dental schools will do some dental care, but that would require you being able to get down to where the dental schools are. But I would also, if you have insurance, call the insurance company and see who might be on there. But if you don't, then I would start with probably Community Health and Dental in this area.
Okay. There's a question here about difficulty in picking up prescriptions at the pharmacy. A person's having a difficult time getting their prescriptions. They want to know if there are programs that exist to help them.
So some of the pharmacies will deliver to you. And there are organizations out there that if you're over the age of 60, we can help you with a volunteer who would run some of those errands for you. But best bet is to call the pharmacy and see if they will deliver to you. Many will for free.
Okay. I think you're right. I don't want to give any, advertisements, but the pharmacy that I use advertises free delivery all the time. And I think a lot of them are doing, just as grocery stores, we were just talking about this today, grocery stores, all kinds of stores are delivering now. Restaurants are delivering, because the pandemic has changed our lives so greatly that there's a lot more help out there for people that can't get out of their homes, or else are afraid to go out because of disease. So I think there is a lot more help now.
And I don't know if they're just meaning about picking up their prescriptions, or are they having trouble picking them up because they can't afford them? So
It just says I have difficulty picking up prescriptions at the pharmacy. So I think it's a transportation issue.
transportation. Thank
Yeah,
you.
I don't think it's addressing the financial piece of that at all.
Well, I'll just throw this out there. There is a program called GoodRx that you can do online and download coupons. Your family doctor might be able to help you with that as well, but that will save you some money if you don't have a prescription plan. And that's always a really good source. I have to do that with a lot of my patients.
Oh, that's a great idea as well. There is another question here, but I think we've answered it. It's a question about community embedded resources for healthcare and other services. And once again, I'm going to direct that person to TriCounty Network, which is TCN. They have so many organizations under them. They can help you, direct you in the right place. So I think that's a good answer for that. I'd like to know from John if there are any other questions that have come in that we haven't asked yet, John.
No, Myra, no new questions coming in live. So I think everything that's left is what we have that came in ahead of time.
Okay, I think that we have, I think that we've done a good job of asking all the questions then that people have asked. And I really want to thank patients, and I want to thank Brian for being such good participants tonight. I really appreciate your help, and you've answered a lot of questions for our community, I believe.
Well, thank you for having me. I appreciate it.
No, we appreciate you being here, and thank you, Brian, so much.
You're very welcome.
Thank you both for what you do in your everyday jobs. You help a lot of people, and we appreciate it very much.
Thank you.
Thank you, Myra. This was a great conversation. Wonderful to have you three together to talk about these issues, and really value your insight and expertise. So thanks for the conversation. And we appreciate everyone who could join us tonight. We'll be following up with a communication listing resources. Based on this conversation, we've got a few here on this slide. Penny is Pennsylvania's health insurance exchange. Visiting Nurse Association has some resources there, and Campaign to Save Lives is another effort we did to kind of get the word out about preventing heart attack, stroke, other don't be afraid to get to the doctor as we come through the pandemic. For those watching on YouTube, look for links in the video description. We'll leave this slide up, and more information is available at TriCountyHealthCouncil.org. Take care of yourselves, take care of one another, and good night.